Hello everyone, Dr. Allan Mandell here. Welcome back to my channel, Science of Healing. If you're a senior, there is one vitamin millions of people take every single day thinking they're protecting their health, but science now shows it may actually be doing the opposite. And right after that, I'm going to share the one vitamin you truly must take daily, because without it, your bones weaken, your immune system declines, your muscles shrink, and your risk of serious disease quietly rises year after year. Let's start with the vitamin you should never take blindly. That vitamin is calcium supplements. Now, before you panic, let me be very clear. Calcium itself is essential. Your body needs it for strong bones, teeth, nerve signaling, and muscle contraction. But the problem is how most seniors are taking calcium. When calcium is taken in high-dose supplement form, especially without the right co-nutrients, studies show it can deposit in the wrong places. Instead of going into bones, it can accumulate in arteries, joints, and soft tissues. Multiple large observational studies have linked calcium supplements, not calcium from food, to an increased risk of arterial calcification and heart attacks, particularly in older adults. In simple terms, your bones may not be getting stronger, but your arteries may be getting harder. As we age, stomach acid naturally declines. This makes calcium carbonate, the most common supplement form, poorly absorbed. So people take more and more, thinking they're helping their bones while their body struggles to use it properly. Excess calcium that isn't absorbed correctly doesn't just disappear, it has to go somewhere, and that somewhere can be your heart and blood vessels. Most seniors take it every morning with absolute confidence, believing they are protecting their bones, extending their independence, and preventing fractures that could steal their freedom forever. But what if I told you that this single vitamin supplement, swallowed faithfully for decades, may actually be silently hardening your arteries, stressing your kidneys, and increasing your risk of heart attack without you ever feeling a warning sign? Because science now reveals that the problem was never calcium itself, but the unnatural way we have been taught to consume it. Calcium is essential for life, no question about it, yet modern research shows that isolated calcium supplements, especially in high doses, behave very differently inside an aging body than calcium from real food, and this difference can mean the line between stronger bones and a weakened heart. Large population studies published in respected medical journals have shown that seniors who rely heavily on calcium supplements have a significantly higher risk of cardiovascular events compared to those who obtain calcium naturally from food. And this risk increases with age because the body's ability to regulate minerals declines every decade after 50. Here's the shocking truth most people never hear in a doctor's office. Your body does not automatically send calcium to your bones just because you swallow it. Calcium needs a complex biological traffic system to know where to go, and when that system is impaired, as it often is in seniors, calcium can end up in the worst possible places. Autopsy studies have found calcium deposits embedded inside arterial walls, contributing to arterial stiffness, plaque formation, and reduced blood flow to the heart and brain. And many of those individuals were long-term calcium supplement users who believed they were doing something healthy. As we age, stomach acid production naturally drops, and this is critical because the most common calcium supplement on the market, calcium carbonate, requires strong stomach acid to be absorbed properly. Without enough acid, much of that calcium passes through unabsorbed, forcing people to take higher doses, while the fraction that does enter the bloodstream arrives without proper regulation. This sudden spike of calcium in the blood triggers emergency responses in the body, increasing the likelihood that calcium will bind to damaged arterial tissue rather than being laid gently into bone. What makes this even more dangerous is that arterial calcification does not cause pain at first. You don't feel your arteries hardening. You don't feel plaque becoming more brittle. The first symptom may be a heart attack, a stroke, or sudden shortness of breath while walking to the mailbox. Researchers have found that calcium from supplements causes a sharper and more rapid rise in blood calcium levels than calcium from food, and that rapid rise is exactly what increases cardiovascular stress in older adults. Kidneys are another silent victim. Calcium supplements significantly increase the risk of kidney stones, particularly in seniors who already have reduced kidney filtration due to age. These stones are not just painful, they are a sign that calcium metabolism is failing. Studies show that calcium from food actually protects against kidney stones, while calcium supplements increase the risk, a contradiction that proves how unnatural isolated supplementation can be. Even bone health itself may not benefit the way people expect. Long-term studies reveal that calcium supplements provide only a modest reduction in fracture risk, and in some cases, no meaningful protection at all when taken without proper co-nutrients. Meanwhile, weight-bearing movement, vitamin D sufficiency, magnesium intake, and protein consumption show far stronger protective effects on bone density than calcium pills alone. In other words, many seniors are taking a daily supplement that increases heart risk while providing minimal bone benefit. Another overlooked danger is joint and soft tissue calcification. Excess calcium can deposit in joints, tendons, and connective tissue, contributing to stiffness, reduced mobility, and chronic pain. This is often mistaken for just aging, when in reality it may be mineral misplacement happening slowly over years. Medical imaging has revealed calcified shoulder tendons, spinal ligaments, and joint capsules in older adults with long histories of calcium supplementation restricting movement and quality of life. Perhaps the most disturbing fact is that calcium supplements are often taken without the very nutrients that control calcium's behavior. Without adequate vitamin D, calcium absorption becomes chaotic. Without magnesium, calcium cannot be properly balanced inside cells. Without vitamin K2, calcium is not directed into bones and is far more likely to accumulate in arteries. Research shows that populations consuming high calcium diets with sufficient K2, such as traditional diets rich in fermented foods, have lower rates of arterial calcification and stronger bones, proving that calcium alone is never the answer. The body was designed to receive calcium slowly, rhythmically, and in partnership with other nutrients, not as a pharmaceutical-style dose that floods the bloodstream. Leafy greens, seeds, dairy, small fish with bones, and fermented foods deliver calcium alongside magnesium, phosphorus, and bioactive compounds that guide it safely into skeletal structure. This is why cultures that consume calcium-rich foods, not pills, often have lower fracture rates despite lower total calcium intake on paper. What makes this issue so dangerous is not ignorance, but misplaced trust. Seniors are told, take calcium or your bones will crumble, without being told that bone health is a system, not a single nutrient. They are rarely warned that excessive supplemental calcium can undermine cardiovascular health, increase inflammation, and accelerate biological aging rather than slow it. The real tragedy is that many heart attacks, strokes, and mobility losses labeled as natural aging may be partially driven by years of well-intentioned supplementation that ignored how the body truly works. Calcium is not the enemy, but blind supplementation is. When calcium is consumed without understanding absorption, balance, and direction, it becomes a liability rather than a protector. This is why modern preventive medicine is shifting away from high-dose calcium supplements for seniors and toward food-based nutrition, mineral balance, and hormonal regulation. The future of aging well is not about taking more, but about taking what actually works in harmony with your biology. And the sooner this truth is understood, the more lives can be protected from silent damage that takes decades to reveal itself. Most seniors don't realize that one silent deficiency is quietly accelerating aging inside their bodies every single day, weakening bones, shrinking muscles, dulling the brain, and sabotaging the immune system long before symptoms ever appear. And the most frightening part is that this deficiency exists even in people who eat well, take supplements, and live in sunny climates, because the vitamin responsible for protecting nearly every system in the aging body is far more complex, far more powerful, and far more misunderstood than most have ever been told. Vitamin D is not just a vitamin. Modern science now classifies it as a hormone, meaning it sends instructions to cells throughout the entire body, and when those instructions are missing, the body begins to malfunction in ways that look exactly like normal aging, even though they are not inevitable at all. Researchers have identified vitamin D receptors in more than 30 different tissues, including the brain, heart, immune cells, muscles, pancreas, and bones, which means a deficiency does not affect just one area. It affects everything at once. Here is the shocking reality. Over 70% of adults over the age of 60 are deficient in vitamin D, and many of them have no idea because the early signs, fatigue, muscle weakness, joint discomfort, low mood, frequent infections, are often dismissed as part of getting older. But large-scale studies show that seniors with low vitamin D levels are significantly more likely to suffer fractures, falls, infections, cognitive decline, cardiovascular disease, and early mortality compared to those with adequate levels. This is not correlation based on lifestyle alone. Even when diet and activity are controlled for, vitamin D deficiency remains a powerful independent risk factor. Bone health is where the damage becomes most visible. Without sufficient vitamin D, calcium cannot be absorbed efficiently from the gut, no matter how much calcium is consumed. This means bones are starved of the very mineral they need to stay strong, while calcium remains circulating in the bloodstream or depositing in soft tissues. Clinical studies show that seniors with low vitamin D have dramatically lower bone mineral density and a far higher risk of hip fractures, which are among the most life-altering injuries an older adult can experience. In fact, up to 1 in 4 seniors who suffer a hip fracture do not survive beyond 1 year, not because of the bone break itself, but because of the rapid decline that follows. Muscle loss is another devastating consequence. Vitamin D directly influences muscle fiber function, strength, and coordination. Research has shown that deficiency leads to muscle atrophy, slower reaction times, and impaired balance, creating the perfect conditions for falls. This is why vitamin D supplementation has been shown in multiple trials to reduce fall risk in older adults, not by making them stronger overnight, but by restoring proper neuromuscular signaling that aging had disrupted. When muscles don't receive the hormonal signal from vitamin D, they literally forget how to work together. The immune system also suffers in profound ways. Vitamin D plays a critical role in regulating immune responses, helping immune cells recognize threats quickly while preventing excessive inflammation. Seniors with low vitamin D levels experience more frequent respiratory infections, longer recovery times, and higher complication rates. Studies have shown that adequate vitamin D levels are associated with reduced risk of severe infections and improved immune resilience, which becomes increasingly important as the immune system naturally weakens with age. This is not about boosting immunity unnaturally. It is about restoring the baseline defense system the body was designed to have. The brain is not spared either. Vitamin D receptors are found throughout brain tissue, and deficiency has been linked to cognitive decline, memory impairment, and increased risk of dementia. Long-term observational studies have found that seniors with chronically low vitamin D levels are significantly more likely to experience accelerated cognitive aging. Vitamin D helps regulate inflammation in the brain, supports neurotransmitter function, and protects neurons from oxidative stress. When these protective mechanisms fail, the brain becomes more vulnerable to degeneration that is often mislabeled as unavoidable. What makes this deficiency especially dangerous is that sunlight, the natural source of vitamin D, becomes less effective with age. Aging skin produces up to 75% less vitamin D from the same amount of sun exposure compared to younger skin. This means that even seniors who spend time outdoors may still be deficient. Add to this the widespread use of sunscreen, limited outdoor activity, and geographic factors, and it becomes clear why vitamin D deficiency is nearly epidemic among older adults worldwide. Diet alone rarely solves the problem. Very few foods naturally contain meaningful amounts of vitamin D, and those that do, such as fatty fish and egg yolks, are not consumed in sufficient quantities by most people on a daily basis. This is why supplementation becomes not just helpful, but essential. The most effective form is vitamin D3, which is the same form produced by the skin and the form most efficiently used by the body. Research consistently shows that vitamin D3 raises blood levels more effectively and maintains them longer than other forms. The way vitamin D is taken matters just as much as taking it at all. Because it is fat-soluble, vitamin D must be consumed with dietary fat to be absorbed properly. Seniors who take it on an empty stomach may absorb only a fraction of the dose. Studies show significantly higher blood levels when vitamin D is taken with the largest meal of the day, particularly one containing healthy fats. This simple timing adjustment can mean the difference between deficiency and sufficiency without increasing dosage. There is also a dangerous misconception that vitamin D works alone. In reality, it functions as part of a tightly regulated system. Magnesium is required to activate vitamin D in the body, and without enough magnesium, vitamin D remains inactive no matter how much is consumed. Vitamin K2 plays an equally critical role by directing calcium into bones and away from arteries. Research shows that when vitamin D is taken without adequate magnesium and K2, the benefits are blunted and the risks of calcium misplacement increase. This is why balanced supplementation is far more effective than isolated dosing. Perhaps the most compelling evidence comes from mortality data. Large meta-analyses have found that seniors with sufficient vitamin D levels have lower all-cause mortality rates compared to those who are deficient. This means vitamin D is not just protecting one organ or one disease pathway, but influencing overall survival. Few nutrients can make that claim with such consistency across populations and studies. Vitamin D deficiency does not announce itself loudly. It erodes health quietly, year by year, weakening the systems that keep seniors independent, mobile, and mentally sharp. By the time fractures, falls, infections, or cognitive decline appear, the damage has often been accumulating for decades. This is why vitamin D is not optional as we age. It is foundational, protective, and deeply intertwined with how the body was designed to function. Taking vitamin D3 daily is not about chasing youth or avoiding aging altogether. It is about preventing unnecessary decline caused by a correctable deficiency. It is about giving the body the hormonal signal it needs to maintain strength, resilience, and balance in the later decades of life. When seniors restore adequate vitamin D levels, they are not adding something artificial. They are restoring a biological message that time has slowly erased. And that restoration can mean the difference between merely surviving and truly living as the years move forward. What most seniors are never told is that taking the right vitamin can still fail or even backfire if it's used the wrong way, because the aging body no longer responds to nutrients in isolation. It responds to systems, timing, balance, and biological signals that either work together or collapse silently over time. Science now shows that many older adults who faithfully take vitamin D still remain deficient, not because the vitamin doesn't work, but because it is being taken without the very partners that activate it, guide it, and protect the body from unintended damage. Vitamin D is only the messenger. It delivers instructions, but those instructions cannot be carried out unless the machinery inside the body is functioning. Magnesium is one of the most critical components of that machinery, yet studies estimate that nearly half of adults over 60 are deficient in magnesium due to poor absorption, medication use, and depleted modern diets. Without magnesium, vitamin D cannot be converted into its active hormonal form in the liver and kidneys. In other words, you can swallow vitamin D every day and still remain functionally deficient at the cellular level. A fact confirmed by clinical research showing low magnesium status is directly associated with poor vitamin D metabolism. This is where the illusion of supplementation becomes dangerous. Seniors assume they are protected because they take their vitamins, yet blood tests often reveal vitamin D levels that never improve. Magnesium deficiency doesn't always cause dramatic symptoms. Instead, it quietly disrupts muscle function, nerve signaling, blood sugar regulation, and heart rhythm. When combined with vitamin D deficiency, the risk of muscle weakness, falls, arrhythmias, and fatigue increases dramatically. Studies show that correcting magnesium levels enhances the effectiveness of vitamin D supplementation and improves muscle strength and balance in older adults, reducing fall risk, one of the leading causes of disability and death in seniors. Then there is vitamin K2, a nutrient so overlooked that many physicians still receive little training on it despite decades of research showing its role in directing calcium traffic inside the body. Vitamin K2 activates proteins that escort calcium into bones and teeth while preventing it from embedding into arteries and soft tissues. Without K2, calcium behaves like an untrained force, settling wherever damage or inflammation exists. Population studies reveal that individuals with higher dietary K2 intake have significantly lower rates of arterial calcification and cardiovascular disease, even when calcium intake is high. This is not theory. It is observed biology in real human populations. The danger becomes clear when vitamin D is taken alone. Vitamin D increases calcium absorption, which is beneficial only if that calcium is guided correctly. Without K2, increased calcium absorption can accelerate arterial calcification rather than strengthen bones. This is why some seniors experience worsening cardiovascular markers despite improving bone density on scans. The calcium was absorbed, but it was misdirected. Research from long-term cohort studies shows that vitamin D combined with adequate K2 intake supports bone strength without increasing vascular calcification, while vitamin D alone does not offer the same protection. Timing also matters far more than people realize. Vitamin D is fat-soluble, meaning it requires dietary fat for absorption. Seniors who take it with coffee, toast, or on an empty stomach may absorb less than half the dose. Controlled studies demonstrate that taking vitamin D with the largest meal of the day, particularly one containing healthy fats, can increase blood vitamin D levels by up to 50% without changing the dose. This single habit change can transform supplementation from ineffective to life-altering. Daily life choices amplify or sabotage these nutrients as well. Sedentary behavior reduces bone signaling, meaning even perfect nutrition cannot fully protect skeletal strength without movement. Weight-bearing activity sends a biological message to bones to retain calcium, while vitamin D and K2 ensure that message is executed properly. Seniors who combine daily walking, resistance exercises, and balanced supplementation show far greater improvements in bone density and muscle function than those relying on supplements alone. The body demands use before it rewards preservation. Food remains the foundation that supplements can never replace. Leafy greens provide magnesium. Nuts and seeds stabilize nerve and muscle function. Fermented foods supply small but meaningful amounts of K2. Eggs and fatty fish support vitamin D intake naturally. Studies of traditional diets rich in these foods show lower fracture rates and better cardiovascular outcomes despite lower supplement use. This is because food delivers nutrients in biologically familiar patterns, not in isolated chemical bursts. Supplements should support food, not replace it. Medication use further complicates the picture. Common drugs taken by seniors, including acid blockers, diuretics, and statins, can reduce magnesium absorption and alter vitamin D metabolism. This creates a hidden cycle where deficiencies worsen despite compliance. Research shows that seniors on long-term medications are significantly more likely to require higher nutrient support and careful balance to achieve the same biological effect as younger adults. Ignoring this reality leads to frustration and false conclusions that supplements don't work. Perhaps the most sobering evidence comes from long-term health outcomes. Seniors with balanced vitamin D, magnesium, and K2 levels experience fewer fractures, better mobility, improved immune resilience, and lower rates of cardiovascular events. These benefits compound over time. This is not about dramatic overnight change. It is about slowing the silent erosion of health that steals independence one system at a time. Each year of deficiency accelerates biological aging, while each year of balance preserves function. The human body was never designed to rely on a single nutrient taken in isolation. It evolved around cooperation, redundancy, and feedback loops. When seniors restore that cooperation, vitamin D to signal, magnesium to activate, K2 to direct, food to stabilize, and movement to reinforce, the body responds with resilience that many believe was lost forever. This is why the future of healthy aging is not found in higher doses, but in smarter combinations that respect biology rather than override it. Aging does not require fragility. Decline is not inevitable. Much of what we accept as normal aging is the result of years of silent imbalance that can be corrected once the truth is understood. When nutrients are used the way the body expects them to be used, they stop being pills and start becoming messages. Messages that tell bones to stay strong, muscles to stay responsive, arteries to stay flexible, and the immune system to stay alert. And that message, delivered daily, consistently, and intelligently, can change the entire trajectory of aging in ways most seniors were never told were possible.